Welcome back to Primetime News. For those of you watching online at onespotmedia.com, a very special welcome to you. Thanks for staying with us. The government is running the risk of the deadly coronavirus seeping into the country. That's the view of the Nurses Association of Jamaica, which is calling for the number of public health nurses stationed at the airports to be increased. Now, our reporter Shamela Pullen sat down with the association's president, Carmen Johnson, in this Primetime News follow-up.
With the heightened threat of the coronavirus, the Ministry of Health last week responded by increasing surveillance at all ports of entry. TVJ News has learned that there are 6 public health nurses stationed at the Norman Manley International Airport and 4 at the Sangsters International Airport in St. James. President of the Nurses Association of Jamaica, Carmen Johnson, argues that the numbers are not adequate.
What exactly we need to do is that maybe we need to look at having more persons out there, because then if you have only 2 persons per shift covering an airport where maybe 300 or 400 passengers coming in, it simply means that at some given point in time, you are going to have reduced outputs. Plus, again, remember, we are all human, so you will have to have bathroom privileges. So at a given point in time, when one is gone to the bathroom, you may be the only one that you have there. How well can you move that 300 passengers in a timely manner through the system?
She further explained that greater monitoring is needed.
If I'm going to St. James or I'm going to Hanover, they will refer me to the individual public health nurses within those parishes and to say, this is somebody we need you to follow up. So they'll take my contact information where I'll be staying and they'll forward it while informing me that those persons will check on me to ensure. If they check on me and recognize that I start showing some signs and symptoms that they presume may be it, then they will seek to say, we recommend this individual for medical care and for quarantine.
The NAJ president says nurses stationed at the Norman Manley International Airport are required to work at nights. The number of nurses who can be rotated is limited because to work at the airport, special training is needed. Many of the nurses who have been trained have either retired or migrated.
To work at the airport, you have to have specific training in understanding what to do. The airport itself has their requirement. And so these individuals who work at the airport have got to go through that level of training, that system that they have there to ensure that you are trained. And so what you find, although we may have 100 public health nurses, not all of those public health nurses are ready to work at the airport.
The NAJ also says there isn't a specially designated area at either airport to quarantine persons suspected of contracting the coronavirus. Add to that, the NAJ president says the screening process for fever is complicated because the nurses at the airports have no digital thermometer and have to rely on old analog equipment for testing. More than 80 people have died in China from the virus and almost 3,000 infected. The virus has also spread to the United States, Canada, Thailand, and Japan. Shamela Pullen, TVJ News.
And we're now joined by Health Minister Dr. Christopher Tufton to detail the country's response to the threat of the coronavirus. Dr. Tufton, thank you so much for joining us. Some real issues highlighted by the NAJ president. Let's just give a summary. Not enough nurses, lack of basic resources like thermometers, digital thermometers, the absence of a designated quarantine area at the airports. Now, the Ministry of Health has said it has implemented adequate measures to respond to the threat of coronavirus. But based on what the NAJ is saying, we now have to question, are you really prepared, Minister?
Well, let's look at it this way. If we were to accept that very extreme position, and I have a lot of respect for the president of the NAJ, then Jamaica would have been exposed to yellow fever, malaria, the SARS virus, all of which have been prevented by the excellent work and the infrastructure that has been provided by our health officials at our ports of entry, meaning our airports and our seaports. The truth is that I have full confidence in our health staff, nurses included, who are there. We have sufficient infrastructure, and that is why we have been able to prevent viruses or new diseases like this particular one from entering our shores. Now, there's always a margin of error, and one could always argue for more facilities, But let's take the issue of an isolation area. The truth is that our health officials at the ports, if the need arises, have access to areas that can isolate an individual who is suspected of having a particular ailment or represents a particular risk. Beyond that, there is logistic support to move persons from the port to a medical facility where we have those in place. So, you know, we're always willing to sit and to discuss with the nurses and the doctors where we think we can improve and work together. What I'm more particularly concerned about is the threat that we face now as it relates to the coronavirus. And the government has been taking action. We had a long discussion today at Cabinet. We brought in the country rep from the Pan American Health Organization. I'm going to be speaking to Parliament tomorrow on the issue. We have sensitized all our frontline staff members. We have prepared our hospital system as it relates to isolation areas. We are being guided by WHO in terms of what they're putting out. And we are tracking the progress of the disease, if you will. It's now in 10 countries throughout the world. And of course, we have persons who visit China and come from China, and therefore we have to ensure that we remain vigilant. So I would say that we are at a good place in terms of our preparedness. I would say we are at an excellent place in terms of our experience, and certainly our health professionals have done an excellent job in protecting Jamaicans from diseases that are not endemic, like yellow fever, like malaria. And they have been using the very same facilities that the president is so critical of.
But at the same time, Minister, we have been losing our nurses.
Mm-hmm.
That
is a fact.
Yes.
That is a fact. So last year we lost, I would say, over 500 nurses to the international marketplace. That is part of the reality of the time that we face, in that there's a huge global shortage, major recruitment with attractive offers that unfortunately we cannot match. So we have opted to do a few things. We're expanding the cadre of nurses that we train. So the University of the West Indies, for example, is now allowed to train 300 a year.
So what about the training of nurses at the airport? Because
at the airport.
Saying, right, so because she is saying that not enough nurses are sufficiently trained at the airport.
Right. So I would say that we have to ensure that some of the new approaches that we take, for example, we just brought back specialist nurses from the UK, Leeds Teaching Hospital, based on a bilateral agreement. We will have to look at the specialist areas where we have needs. There are about 8 of those areas. And if it requires additional training through these bilateral agreements for the airports, we will certainly be willing to engage in that process.
Okay, so much to be said about that issue, about resources, etc. But break it down for us in terms of the screening process. So let's say, for example, I went to China, I arrive at Sangsa International Airport. What is likely to happen?
Right. So based on our tracking of the movement of persons in collaboration with the immigration officials, some persons would be at greater risk and by extension would be subjected to greater inspection and detention if necessary. The nurses or health officials at the ports have the capacity to do basic checks. So body temperature, for example, is an important part of the overall check.
But they're using an analog system, sir.
The truth is, it works. And I'm prepared to say
it works.
I'm prepared to say that we can always discuss the need to improve, and I'm prepared to accept that. But Jamaica has done well in protecting its borders, and we should not beat up on ourselves too much about that, although I agree that we have to work to improve. So those persons will be subject to inspection and, if necessary, detention or quarantine. And we take it from there as it relates to transferring them to the hospitals. Luckily, we have no cases as yet, and we are going to be working diligently with our partners, with our multilateral partners, bilateral partners, to keep it that way. And I'll speak more specific to that in the Parliament.
So are you discrediting the concerns by the NAJ
Of course
president?
not. Of course not. I think it's so essential for us to work together. And I have a lot of regard for the president of the NAJ. I think she has championed the cause of our members. But again, I say, in situations like this, we have to be careful that we do not create an impression that we are laid bare and exposed, because we would be doing ourselves a disservice. Our nurses have worked very hard, And yes, they do come under stress. And as a government, we want to work with them, which is why we have done a number of things to support. I think it's important for the Jamaican people to understand that we all have a role to play, which is why public education is key, but the government is taking this issue very seriously.
I wanted to get into the symptoms. Can you just
It's
give
the
us
same.
an idea?
It's the same flu-like symptoms. It's a new virus, and therefore the global population's immune system to the virus is the challenge. There's none, and therefore we have had just under 3,000 cases, I'm told. It has now spread to 10 countries, including Canada and the US. The chances of it getting to Jamaica, we cannot take for granted, and so we have to be vigilant. But the symptoms are similar to the common cold. It's a respiratory illness, so pneumonia ends up being the ultimate consequence, and then, of course, the risk of death. So the fever, the rash, the headache, all the symptoms of a flu would be requiring us some examination, particularly if you were exposed to someone coming from China, or you yourself were coming from those parts.
Okay, Minister, so much to talk about, but not enough time. And tomorrow we should hear more in Parliament.
Thank you very much for having me.
All right, thank you.